Despite many less invasive and less radical contraceptive methods, many women opt for tubal ligation. Unfortunately, many of them will end up regretting this choice for various reasons. A new union, regret not having a baby, the death of a child, the death of the spouse. A question then arises: can we have a child after tubal ligation? Definitive contraception? The tubal ligation is a surgical procedure that aims to block the fallopian tubes to prevent the egg down to the uterus and make contact with sperm. Consequently, fertilization is impossible. In medicine, this contraceptive method is said to be definitive, since a tubal reanastomosis, tubal repair, is a complex procedure whose success is not guaranteed. Tubal reanastomosis. Tubal reanastomosis is a surgical procedure aimed at restoring fertility by restoring the patency of one or both fallopian tubes, explains Dr. Pierre Miron, obstetrician-gynecologist, founder of the Fertylis clinic. The procedure has its share of risks since it is mostly performed under general anesthesia. Following such an operation, the chances of having a natural pregnancy are relatively good, 25% to 80%. Quote. However, depending on the ligation method used or the length of the healthy tubes, it may be difficult, if not impossible, to perform tubal reanastomosis, adds Dr. Miron. It is therefore case by case. In vitro fertilization. If tubal reanastomosis proves impossible or unsuccessful, women can use assisted reproduction. Since the fallopian tubes are unusable, artificial insemination is excluded. IVF, in vitro fertilization, is therefore the last resort for women who have had a tubal ligation and who aspire to another pregnancy. At the very beginning of the procedures, the spouses must undergo a battery of tests in order to establish their fertility. History, a basal temperature, blood tests and spermogram are necessary before venturing on the path of assisted reproduction. IVF may be considered if the ability of the ovaries to produce eggs is preserved and there is no pathology in both spouses, for example, cancer. The risks of IVF. Having recourse to in vitro fertilization is not without danger, although it is less risky than tubal reanastomosis. Hot flashes, bleeding and abdominal pain can occur during treatment. Although unpleasant, these discomforts are most of the time without major consequences. In 1 to 3% of cases, ovarian hyperstimulation syndrome can occur. This is an abnormal increase in the size of the ovaries which is accompanied by abdominal pain, bloating, fever, nausea, vomiting and diarrhea. Very rarely, we are talking about 1%, the patient may experience difficulty in breathing, accumulation of fluids in the abdomen, blood imbalances and blood clots in the legs and lungs. The costs of tubal reanastomosis versus IVF. Like tubal ligation, tubal reanastomosis is covered by the Régie de l'Assurance Maladie du Québec, RAMQ. Conversely, all costs relating to in vitro fertilization must be assumed by the patient since they are not covered by the RAMQ. The post-tubal ligation design is therefore theoretically possible. It is, however, a complex and not without danger. Reanastomosis can be a technical success without pregnancy occurring, and IVF does not mean 100% success. In this context, tubal ligation should be considered as definitive contraception.